Welcome to this episode of Substantial Matters, Life and Science of Parkinson's. I'm your host, Dan Keller. At the Parkinson's Foundation, we want all people with Parkinson's and their families to get the care and support they need. Better care starts with better research and leads to better lives. In this podcast series, we highlight the fruits of that research, the treatments and techniques that can help you live a better life now, as well as research that can bring a better tomorrow. Only about 40% of people with Parkinson's in the U.S. see a neurologist for their care, and even fewer see a specially trained movement disorders specialist. This leaves many individuals and whole communities lacking crucial Parkinson's information and resources. But like the disease itself, education and services for Parkinson's are not one size fits all. As I'm sure you know, outreach must be tailored to different communities and come from a trusted source to be effective. I spoke with Daley, manager and research coordinator at the University of California, San Francisco Parkinson's Disease Clinic and Research Center, about his community education and outreach initiatives. His experience and tips are helpful for anyone interested in becoming more active in the local Parkinson's community. Whether you are a person affected by Parkinson's, a healthcare provider, a community leader, or a compassionate citizen, or all of the above. One note before we dive into the conversation. At the beginning of our chat, Aaron mentions Moving Day, a walk for Parkinson's. This event takes place in more than 30 cities across the country. Funds raised through Moving Day support the Parkinson's Foundation's mission by helping to deliver expert care through our Centers of Excellence network, funding cutting-edge research, and providing free resources for people with Parkinson's and their families.
What we were hoping to do was some additional outreach and education into populations that may not have been accessed previously or that there was a need for. So we applied for an NPF grant based on the funds that were raised by Moving Day. They make a big point of saying that some of the money that is raised, that stays in the community to fund these kinds of things. And we thought this is a great opportunity for us. Our focus was into the Asian communities in San Francisco. About 25 to 30% of the population of San Francisco is of some sort of Asian background. And obviously there's a very large Chinese population in San Francisco as well. Our focus was into Chinese, Japanese, and Filipino populations. We applied for the grant. We had 3 goals. They were to increase outreach and education with the general public, to do some additional trainings with the health professionals, the people that are, sort of the first line seeing patients in these communities, and also translate additional materials that we had so that they could be more accessible.
When you approached those different communities, did you have to do it in different ways, or did you have to get into them through people who are of those ethnicities?
Luckily, we had good contacts with the Chinese and Japanese communities through some work that we had done in the past. And those relationships actually had been developed by the center coordinators that had come before me. And that really, more than anything, helped us to have a lot of success with those communities. All we had to do was contact the person that we had worked with in the past, say, we have this great opportunity to increase, the outreach and education that we've been doing. Are you interested? And they, of course, were very excited as well. And it was a really easy process for that, because then it just was, hey, let's sit down and make a game plan. What do we think is possible? What do you need from us? What would you like to have from us? And the conversation was just instantly moved forward into action.
What were the access points into the communities?
For the Chinese community, there is a large organization called Self-Help for the Elderly. They provide health services for something like 50 to 60,000 people. They encompass much more than just medical health. They also do, social work. They have a long-term living facility that they manage. They do daytime facilities for seniors, as well as just the general health and wellness initiatives, better nutrition, all those kinds of things. And we were lucky enough that our contact point with them was the CEO of that organization. So when you start off with the CEO, you know things are going to go well. And then in the Japanese community, we worked with Kimochi, and that as well, we had a good relationship in the past. And as well, our contact point was the CEO. And it really just made everything so much more smooth to be able to instantly have not only the person in charge, but a way of saying, so who should I talk to about this particular component? And they could bring that person in immediately, and there was no waiting around and start working.
Were these communities underserved? Do they have demonstrably better outcomes now than otherwise?
I think that they are underserved. I think part of the issue is that certainly in the Chinese community, it's very insular. They do everything in their daily lives within Chinatown. That's where they do their grocery shopping. That's where they see their doctors, every component of their life. And for us, when we do outreach and education, most of what we do is inviting people to come to programs or sending out something that says we're going to be doing a Parkinson's 101 overview, that sort of thing. But it's rare, I think, that we really would be able to access those communities, mostly because, there might be a language barrier. But I think also just because in our general work in the community, I think that we didn't have the things in place to really get in and to make sure that these communities were being accessed. So to have a specific goal in mind to make sure that that information was going to get there.
Was it all a bed of roses? I mean, did you find any problems that you had to overcome?
The main problem really was that when we didn't have a strong community contact at the beginning, it was very hard to get things going. It was interesting as well that we also had an organization that wanted the materials that we had created, but wasn't really interested in doing much beyond sort of accepting the additional modules that we might have had translated. We have a movie as well that we had put Chinese subtitles into. But beyond that, they just weren't really interested in doing much else with us. And I think a lot of that had to do with the specific population that particular agency worked with. They saw that the reality of the situation was that the people they worked with weren't going to get much from a real directed outreach education program. They wanted to have the materials available, but that was about the most that they thought they could do with their community.
Do each of these communities want to see physicians of their own community? Or will they go to UCSF, where I'm sure some of the physicians are, but not necessarily?
I think that there is a pretty strong pull to stay within their community. Dr. Christine did a presentation at NEMS, which is the Northeast Medical Systems, and spoke specifically to all of these primary care providers who are seeing these patients. And it's in Chinatown. And that seemed like a really good way for us to make sure that the people we know that are seeing this population in sort of at first, that we at least have a line both in doing some outreach and education, but also that those physicians now know someone at UCSF that if they have follow-up questions or additional things that they need to ask, that they have sort of a warm body they know they can contact.
If other people want to emulate this sort of thing that you did, what's your advice?
Make sure you've got a strong community contact in place before you start planning too much, because you don't want to waste a lot of time creating something that then you present and it goes nowhere because you didn't have the guidance of the community agency at the beginning.
I suppose that goes for materials also. What are they going to use? How do they absorb things?
Yeah, and I think for us getting things translated, we wanted to do that locally as well, rather than sending it out to some large-scale medical translations, but make sure that it's done by someone who we have a really close contact with that can send us proofs of things that we can then give to our community agency contacts to review, because there were always things that they would understand we were trying to get across that weren't quite getting across in the translation. And it's really just a tweaking. But having that really personalized contact, as opposed to having to email with some person who is working out of the East Coast somewhere, who has some team that they don't work with, but that they send documents to and it comes back to them, it just makes it a lot harder when you have to do revisions, as opposed to somebody that lives in the Bay Area that can get things back to you on a much quicker basis and is much more responsive when changes need to be made.
Anything important or interesting to add?
It was a great program. We really enjoyed doing it. I think that it was nice as well to strengthen the contacts that we already had, and we're excited, I think, to try and do more of it on a regular basis. And also a good learning lesson that we need to start developing those same sort of friendships with other agencies in the Bay Area so that we can access additional groups that might need outreach and education.
Very good. Thanks. Hopefully you have access to resources in your community similar to what Aaron describes in our conversation. If you don't know where to find them, call our toll-free helpline at 1-800-4PD-INFO. Our PD information specialist can help you locate healthcare providers, wellness classes, and moving day events. You can also start your own support group or programs. If you'd like to take action to help improve the lives of people affected by Parkinson's in your area, partner with your local Parkinson's clinic or Parkinson's Foundation chapter. Trust is key when it comes to establishing and maintaining good relationships with your doctors and with the community at large. Once established, these relationships can afford more opportunities for outreach and engagement, ultimately leading to better care and better lives. In our next podcast, we'll follow up on the theme of outreach, focusing on Hispanic communities. Please call our helpline for more ideas and resources to bring better Parkinson's care to your communities. If you have any questions about the topics discussed today, or if you want to leave feedback on this podcast or any other subject, you can do it at parkinson.org/feedback. We'll respond to some questions in future episodes. At the Parkinson's Foundation, our mission is to help every person diagnosed with Parkinson's live the best possible life today. To that end, we'll be bringing you a new episode in this podcast series twice a month. Till then, for more information and resources, visit parkinson.org or call our toll-free helpline at 1-800-4PD-INFO. That's 1-800-473-4636. Thank you for listening.